Namaskar. You're watching Dr. KK Med Talks Fridays with Dr. Anita Kant, non-stop show 951st episode. Let's have the headlines of the day. According to WHO reports, global contraceptive prevalence of any method was estimated at 65% and of modern methods at 58.7% in 2022. Researchers find that preconception stress can significantly affect women's health undergoing fertility treatment. Pregnant women are more likely to have high glucose levels if they report worse psychological stress before conception, according to study. A new study links acetaminophen use in pregnancy to modest but significant delays in the language development in children. Research reveals blood tests can identify genetic diseases in fetuses. So now let's go to the topic of the day. Now let me introduce our special guest, Dr. Ash Sujit G, who is going to be talking about twin pregnancy. As we all know, that due to more and more IVF cases, twin pregnancies are on the rise. And also, many a times it appeals to the young girls to have twins, and because it's shown so nicely in movies, they want to have twin pregnancies, and that is a real good thing or a deterrent. Today, Dr. Sujit will be telling us. Meet Dr. Ash Sujit G, a distinct obstetrician and gynecologist with over 7 years of clinical expertise. He is holding an MBBS and DNB in Obs and Gynae from the National Board of Examination, New Delhi. He is currently a consultant in gynae and obstetrics at PD Hinduja Hospital, Khar. Dr. Ash is renowned for his extensive training in gynae endoscopic surgeries, earning him fellowships and accolades. As an enthusiastic academician, he underscores the importance of awareness in preventing illnesses. He is not only a practitioner but also a passionate advocate for open conversations on women's health and social issues, as reflected in his popular podcast channel Guy from Gynec. So, Dr. Saab, today हम बात करेंगे about twins and twins in pregnancy. So, can we start? There
So,
is some
first of all,
echo.
thank you.
There is some
Can
echo.
you?
I think some phone is on somewhere. Is it so?
Not at my end, just find out
Okay,
from
right.
them.
Okay, fine.
Okay. So, good
Yes,
evening,
let's
Dr.
start.
Anita. Good
Good,
evening,
good
everyone
evening.
gathered here, and good evening, everyone from at IJCP. So, to begin with today's topic, when I was given this topic of twin pregnancy, the important thing that always come to my mind that you always said that it seemed very fancy that you can have one pregnancy, two babies, jhanjat khatam. That is what women think nowadays. But then you have to understand that every pregnancy has its own complication. And to add to that, now that you have a twin pregnancy, everything is double. The complication risk can also be double. The trimester wise, what we say that 3 3 महीने का गैप रहता है उसके बीच में जो प्रेगनेंसी रहता है हर एक पार्ट में वहां पे भी तकलीफ हो सकती है and eventually the delivery also might be a little difficult, so it's not always that it's very easy. Yes, we try our level best to work it out and make it very easy and very comfortable for you, but then there are a lot of challenges that we come across which differ again from patient to patient, but then twins itself have a lot of risk in general, not just for the mother but also for the babies and definitely for the gynecologist. So let's see if these are the basic overviews that I want you to know, because I can go on and on with this topic, but if we have any questions, we'll take that so that it becomes easier for me to direct things if I have to do.
I have lots of questions from our viewers today, and also some questions that I have added. So the first question that somebody asked, a lot of people asked, so I've taken up the common questions. Do all twins look and behave and also think alike? This is the
No.
most common question being asked.
So this is what happens when you watch too many Bollywood movies. Okay, so it's never like that. Okay, so looking twins might look the same when they are fraternal twins, but most of the time we don't have that. So there you have to understand one basic concept. There's an egg, there's a sperm, they fuse together, they form an embryo which will form to a baby. There are different weeks that division happens. If the division happens at some place where the division happens and that one thing is dividing and giving rise to two parts, two embryos, that can be identical. Okay. That can be something which is like what you see, that the face might look, the features might be the same. Okay. So that's the only thing. Otherwise, most of the times what we see, and nowadays, which is very common, which I guess there'll be a lot of questions on the basis of that, that IVF is something where we put one egg, that entire egg and sperm which is fused and forming an embryo, one pregnancy, then again one egg, one sperm fusing one pregnancy. So now you're seeing that there are two embryos. Basic knowledge, जो अंडा रहता है, जो हम लोग उबाल के खाते हैं, that egg, one egg. So वो सेम नहीं रहता ना. Everyone doesn't have the same amount of yolk, same amount of white thing which is there, जो egg का रहता है. So it's always different. So similarly, it's not something like भले वो एक ही मुर्गी से आया हो, so it's never the same. Unless and until that one egg का जब भी division हुआ था, long time back when it happens, and वो egg अगर divide होके दो part में बन गया, then it will be identical. Otherwise नहीं होता है. वो सिर्फ पिक्चरों में दिखाते कि एक को लगा तो दूसरे को भी लगता है.
सही बताया आपने. So क्या ये safe है to choose to plan twins?
नहीं. Again, choose to plan twins. Twins have one of the biggest risk factors. पहले तो हम बोलते थे कि 1 in 80 pregnancies में ये रिस्क रहता है कि ट्विन प्रेगनेंसी हो. अगर मैं रिस्क रहता है कहता हूँ, मतलब इट्स अ डिफिकल्ट सिनारियो एंड चैलेंजेस बहुत ज्यादा रहते हैं. तो इट्स नॉट सेफ टू प्लान अ ट्विन प्रेगनेंसी. अगर रह जाता है तो देन इट बिकम्स माय रिस्पॉन्सिबिलिटी और अ गायनेक्स रिस्पॉन्सिबिलिटी कि वो सिचुएशन को हम आपके लिए इम्प्रूव कैसे करें, हाउ वी मेक इट a pleasant experience for you. That way, I can't be telling you कि नहीं, you got twins, so ये गलत हो गई. नहीं, गलत नहीं है. That time we'll manage it out. But when you're planning for it, it's not something which you can plan A. ऐसा होता नहीं है. अगर होता तो I think सब लोग वही opt करते थे. But then it's always wiser to have one pregnancy, move on safely with one baby inside rather than having two or three. What we see in the news that yes, 7 babies, someone had 5 babies, a lot of complications, and you know that nowadays NICU and everything is difficult. And the second thing that you have to understand that these babies are mostly premature. So then the risk of the babies going into NICU, that also increases. So everything adds a burden, not just for the mother, but also financially for both the parents. And also it's a difficult challenge for the doctors. So it's never wise to plan twin pregnancy from anyone's end.
बहुत अच्छा बताया आपने. So क्या during twin pregnancy are the problems of growth very common in twins, more common than singleton या एक बेबी की pregnancy?
Okay, इसका आंसर हम ऐसे देते हैं ना, जो I always answer my questions in a way जो पेशेंट्स को या पब्लिक को ज्यादा इजीली समझेगा. तो अगर आपके पास एक टब है जो हम लोग हर रोज सुबह नहाते हैं ना, तो अगर आप एक मग्गा घुसा के पानी निकालोगे या एक मग्गा डालोगे तो पानी बाहर आ जाएगा. 2 मग्गा डालोगे तो और डिफिकल्ट हो जाता है दोनों मग्गे को अंदर डालने के लिए. सिमिलरली यू हैव वन यूट्रस, इन दैट यू आर पुटिंग वन बेबी एंड देन वन मोर बेबी. Imagine that one baby anyways उसको इतना stretch होके the uterus stretches and tries to accommodate one baby. अभी you are putting one more, तो ऐसा नहीं होगा ना. एक केक के टिन में एक ही केक बनेगा ना, 2 केक बनाने जाओगे तो थोड़ा डिफिकल्ट हो जाता है. Similarly, it's always a challenge when you have a twin pregnancy growing inside one uterus because A, they are fighting for space. But then there are a lot of hormonal changes which happens. The blood supply is affected. So they land up with a slightly smaller weight. That can be one of the complications. And एक level पे जाके the uterus decided, नहीं, now I'll start contracting. That is what we call premature labor या preterm contractions. In twin pregnancy, अभी even that happens roughly, for example, अगर हम लोग arbitrary number देते हैं, 3.5 kg का baby weight हो गया, the uterus decides कि नहीं, now I'll start contracting, and it contracts. वो एक बेबी के लिए. अभी अगर हमारे पास 2 बेबीज है, तो अगर 1.7 के दोनों बेबीज ऐड कर दो, तो that will be 3.4. The uterus might decide कि अरे 3.4 तो in general हो गया, तो let's contract. But the uterus doesn't understand कि ये तो 1.7, 1.7 दो है. 1.7, 1.7 is hardly 30, 32 weeks. So chances
Yes.
of preterm babies also increase. So that is why complications होते हैं जहाँ पे birth weight is slightly less. A, because they are fighting for space, because the placenta supply is less, and second, they are mostly preterm babies. So yes, the birth weight is also less. But they pick up,
Great.
manage ho jata hai. That depends on how good an NIC you have and how good your nutrition has been. But overall, outcome is better if you have a good setup. But then yes, birth weight can be less.
Right. So, yes, please
No, no.
complete.
Let's go
Okay.
ahead. Let's go.
So there's another lady who's asking, क्या high BP or diabetes are more common during twin pregnancies?
High BP नहीं, diabetes है. High BP can happen because of multiple reasons. But I'll tell you the reason for diabetes also. High BP कभी कभार दिखता है. What happens is आपका जो blood flow है to the baby is from a thing what is called placenta, जो हिंदी में वार कहते हैं. तो placenta से vessels आते हैं and that reaches out to the baby जो umbilicus के around attached रहता है. अभी to manage a twin baby, you require a larger placenta sometimes. ओके तो लार्जर प्लासेंटा, अगर एक प्लासेंटा से वो बेबी आता है तो कभी कभार दो दो प्लासेंटा रहते हैं, विच इज हैप्पी, विच वी आर हैप्पी विद. दैट इज कॉल्ड डीसीडी. हमारे में टर्म्स रहते हैं, डीसीडीए, एमसीडी, ऐसे टर्म्स रहते हैं. बट अगेन दैट प्लासेंटा कैन बी अ लिटिल मोर लार्जर. एंड दो प्लासेंटा अगेन सेम फंडा, दो प्लासेंटा है तो साइज, सरफेस एरिया ऑफ द प्लासेंटा विल बी मोर. सो देयर इज अ हार्मोन जो प्लासेंटा से सिक्रीट होता है, दैट इज एचपीएल, ह्यूमन प्लासेंटा लैक्टोजन. दैट स्टिमुलेट्स योर इंसुलिन and that can mess up with sugars, and that is why we can notice a higher risk of diabetes in twin pregnancy. Blood pressure usually zyada nahi rehta, but then again complications sometimes are more in twin pregnancy. That is why you can find out that placenta supply is affected at times, and that is why you might find blood pressure high. But diabetes is something which can be observed commonly in twin pregnancy.
Right. एक lady has asked a question. She says, I'm a working woman, and since I'm pregnant with twins, will I need to proceed on leave early?
That depends your gynec and yourself. मैं हमेशा है ना मेरे पेशेंट्स को एंड तक काम करूँ, कुछ है तो आई एम देयर. That way we carry on, but then depends on complications. अभी वही बात है कि for you, you might start feeling breathless, indigestion, acidity. वो बहुत ज्यादा जल्दी आ जाता है compared to any other lady जिसका एक बेबी रहता है, because uterus एकदम से ज्यादा बड़ा हो जाता है and सोने में तकलीफ होती है. तो all these things will affect your daily routine also. If you're facing something like that, then obviously you might require leaves early. Medically not required ki you have to take leaves early, but depends on your physical ability to cope with certain things. So again, if you have some complications which are affecting because of the twin, because of your inability to perform some activities, then yes, you will require an early leave from your maternity thing, whatever happens in. So that depends again, like I said, on the discretion of your doctor, your gynecologist, and yourself.
बिल्कुल सही बताया आपने. And this lady is asking, can I have a normal delivery with twins?
Okay. ये है ना अभी I'll tell you one thing very honestly. I guess there are many doctors and अगर मैं ऐसे बोल दूं ना बहुत controversial है. You can have a normal delivery with twins, but then there are a
Yes.
lot of difficulties which happen in. एक चीज याद रखना, नॉर्मल डिलीवरी भी होता है ना, उसका भी बहुत कॉमन चीज होता है कि हेड नीचे होना चाहिए. अगर हेड
दोनों.
नीचे है तो नॉर्मल डिलीवरी के अटेम्प्ट तो कर सकते हैं. बट अगेन द बेबीज, लेट्स गो बैक रेट्रोस्पेक्टिवली. Patients जो रहते हैं twins pregnancy, they might have other complications like we discussed diabetes. Second, the babies might be premature. ठीक है, तो the babies might be smaller. So with all the complications and prematurity, delivering such babies vaginally will be a task itself, and it will add to more distress for those babies. Okay, and abhi twins itna खींच लिया है, तो it's obviously we want as gynecs to deliver and give them a better post delivery outcome. So इसके लिए nowadays we have started opting a lot for cesarean. Again, concept ये है कि एक ही तो scar चाहिए क्योंकि दो babies already आपको मिल रहे हैं. तो एक scar में दोनों babies आ जाते हैं and you won't require another scar, and the outcome also is seen to be better. But not denying the fact कि normal delivery करा सकते हैं, but again from an experienced doctor. अगर क्राइटेरियाज बैठते हैं, तो कि बेबी शुड बी नॉट टू लार्ज, पोजिशन ऑफ द बेबी, देर आर नो कॉम्प्लिकेशंस, आपका सर्विक्स डायलेटेड होना चाहिए, कॉन्ट्रैक्शंस बराबर आने चाहिए, एनआईसीयू फैसिलिटीज है, तो दीज आर सर्टेन क्राइटेरिया दैट वी कीप इन अ माइंड. बट अगर ये है तो यू कैन गिव अ ट्रायल, but again keeping in mind ki eventually the outcomes of the pregnancy have to be better, मतलब the babies have to be fine. इतना 9 महीना खींचा है, 8 महीना खींचा, अगर babies fine नहीं रहते तो then it doesn't serve the purpose. So cesarean is always a wiser option if you ask me.
Ultimately, end result matters most,
And it does
right?
matter. Yeah.
Yeah. So, this lady is asking, will the babies always be kept in nursery after delivery in case of twin?
There's one thing that we do in twin pregnancy or anywhere where we find that preterm delivery हो सकता है. Preterm as in जल्दी delivery हो सकता है. We give them steroid injections. Steroid injections are some injections which will help in the baby's lung maturity, that will improve the baby to breathe well after delivery. So what you need to understand is usually the baby's breathing mechanism starts properly at around 34 weeks के बाद. Okay, 30 to 34 weeks के बाद. When you have a chance that the babies are delivering early, then the baby's breathing is not proper. Then the babies have to be intubated, ventilation पे रखना पड़ता है. They give a injection, they give a drug which is called surfactant. Surfactant is something which is secreted from the lungs. In general, हम सब में रहता है, which will make our breathing easier. But that forms only after 32 weeks. अगर मैं steroid injection देता हूँ कोई mother को, that will stimulate the baby's lung to produce surfactant early, which will reduce the number of days the baby has to stay in the NICU. It won't totally stop the thing that ki babies NICU nahi jaane wale, but babies might require to go to the NICU. Again, the babies might be slightly low in birth weight. For observation, they might require to go in the NICU. In general, what we have noticed and what even the studies say that twin babies might have higher risk of other complications like structural complications. कोई हार्ट में तकलीफ हो सकता है या कुछ और लिम्ब में तकलीफ हो सकता है, तो ये सब चीजों के लिए भी ऑब्जर्वेशन लगता है. तो इट्स नॉट जस्ट दैट वी वांट टू पुश द बेबी टू द एनआईसीयू. Complications like the baby's breathing is affected, or if the babies are very low, sugar balance ke liye, or if there are any other complications like structural complications, then only the babies are put in the NICU. And even if the babies are put in the NICU, we decide on the number of days. The steroid thing, the most common reason that we put the babies in the NICU is because of respiratory issues. सांस लेने में तकलीफ होती है, and with the steroid injection, we even reduce the number of days so that we preempt that thing and reduce it for you and for the babies.
Very correctly said. Actually, the next question was this from a patient. Now, somebody is asking, my cousin has a twins pregnancy. One of the babies not alive now. In the 7th month, they found out. Why would it have happened, and what should be done now?
ये है ना, अभी recently I was funny, आज एक सुबह जिस patient को मिला था एक, so she had the same situation. Now she is fine. The other baby is 3 years old. So what happens is there are multiple reasons. One of the commonest things is the placenta stops functioning well. So that can be one of the most common reasons of having one of the babies not surviving, what we call as IUFD, intrauterine fetal demise. Okay, so IUFD can have multiple reasons. Common thing, just for the general audience, ki placenta is not functioning well. Abhi ye ho gaya around समझो 7 months. But now my target is the other baby has to be good, has to be delivered well. So this IUFD can happen at any point of time. It can happen at initial stages also, initial trimester, second trimester, या last trimester maybe. So that you can figure out when it happens, and then a preventive thing starts. अगर बहुत जल्दी हो जाता है, so the growing baby will press on this baby, and this baby becomes like a paper or like a leaf. That is called fetus papricus. हम सिर्फ उसका नजर रखते हैं sonography में, तो उसका ज्यादा कुछ टेंशन नहीं रहता है. Now my worry is कि ये हुआ around 7 months के around. So two things. एक तो ये baby already वहाँ पे पड़ा हुआ है, that will start degenerating, तो उसकी वजह से infection हो सकता है. दूसरा, this baby will start macerating, what we call as again degenerating. उसकी वजह से mother में effects हो सकता है, which is called DIC. तो मेरे को दो चीज मैनेज करने हैं. एक इन्फेक्शन मैनेज करना है, दूसरा DIC मैनेज करना है. और इन सब में द आउटकम हैज टू बी कि बेबी जो दूसरा अलाइव है, दैट हैज टू बी फाइन. and the mother does not go into preterm contraction. तो इतने सारे चीज अपने को मैनेज करना. तो how do we manage? हम लोग यूजली सोनोग्राफी वीकली या 2 वीकली करते हैं, इनमें थोड़ा फ्रीक्वेंटली बढ़ा देते हैं. एंड वी डू सम ब्लड टेस्ट जहां से हमको पता चलता है कि ये डीआईसी में मदर नहीं है. डीआईसी इज बेसिकली व्हेन द मदर कैन ब्लीड अ लिटिल. तो ये दो चीजों का अगर हम ध्यान रखते हैं, सोनोग्राफी करते रहते हैं एंड डीआईसी प्रोफाइल मेंटेन करते हैं एंड वी फाइंड आउट दैट इन्फेक्शन नहीं है, तो इन सब चीजों के हिसाब से अगर हम बैलेंस बराबर करते हैं तो देन आई डोंट थिंक कि कोई प्रॉब्लम होना चाहिए. वी कैन पुल ऑन द प्रेगनेंसी एंड मेक श्योर दैट द मदर इज अवेयर कि ये सब रिस्क हो सकते हैं, एंड देन द आउटकम कैन बी बेटर फॉर द pregnancy or the baby that is alive. Okay, doctor?
So now next they are asking it, why twins are more common with IVF pregnancies?
Iska, the answer is because we want outcomes. Okay, that's the direct answer which I'm saying कि हमेशा IVF का result चाहिए रहता है. Even as parents anxious रहते हैं कि इतना time try कर लिया, then what can we do? So nowadays when we do IVF, though abhi there's a different rule that has come in. You have to put only 2 eggs. The initial thing that we discussed, that eggs रहता है, so we put 2 eggs. पहले तो 5-6 डाल देते थे अंदर, which can be very complicated for the mother. But अभी 2 eggs डालते हैं, या बहुत कम जगह पे 3 eggs डालते हैं. तो अगर 2 या 3 हम लोग डालते हैं in the hope कि at least 1 तो survive करेगा and will pull on. There are times जब दोनों चिपक जाते हैं, दोनों survive कर लेते हैं, then obviously the chances of twins can be more. So इसके लिए you can never predict how many will stay, how many will continue. But as a rule, we usually do 2 eggs currently as per the dictum. So yes, if 2 eggs are there inside and they both flourish and they both carry on, the chances of twins will be obviously higher in IVF pregnancies.
So next question is, if I have a twin pregnancy, will the symptoms of early pregnancy like vomiting be more?
Yes, यही चीज है जो सबसे ज्यादा परेशान करती है. Symptoms of pregnancy will be more. So there's a hormone called beta HCG जो प्रेगनेंसी में राइज होता है, और ये हार्मोन आपके ब्रेन की एक जगह पे अटैक करता है जहाँ के जिसकी वजह से आपको वॉमिटिंग होता है. बट यही हार्मोन आपके प्रेगनेंसी को बढ़ाने में हेल्प करता है. तो ये अभी एक बेबी से समझो अगर मेरा बीटा HCG 10,000 होता है, अगेन आर्बिट्री नंबर, 2 बेबी से ये बीटा HCG 20,000 हो जाएगा. तो अभी वो 10,000 से ऑलरेडी कंप्लेंट हो रही है, तो 20,000 से तो डेफिनेटली कंप्लेंट होगी. तो योर कंप्लेंट्स ऑफ नॉजिया, वॉमिटिंग, सिकनेस, या तो मन नहीं लगना काम करने में, द यूजुअल थिंग दैट वी गेट टू हियर इज डेफिनेटली हायर इन द फर्स्ट ट्राइमेस्टर. सेम थिंग ओवर द लास्ट ट्राइमेस्टर, योर issues of acidity, indigestion, sleeplessness, सांस लेने में तकलीफ is also higher. So these are initial and the end stages complication, symptomatic complications. Again, once the uterus starts growing faster, so you have urinary complaints which can happen. And so all these things are very common issues that we come across in a twin pregnancy, more compared to a singleton pregnancy.
The next question is, can I do exercises while carrying twins?
बिल्कुल ट्विंस के साथ भी एक्सरसाइज कर सकते हैं, बट देन योर एक्सरसाइजेस शुड बी ऑब्जर्व्ड एंड शुड बी डिसाइडेड बाय समवन. हमारे यहाँ पे वी हैव अ लेडी हु manages all the ANC exercises. So even with twins, you can do. Certain places where we don't allow you to do exercises is when, again, we are suspecting कि जल्दी delivery हो सकता है, या तो the cervix is shorter. So cervix can be shorter because uterus बड़ा हो रहा है, तो नीचे का जो cervix है वो छोटा होते जाता है. So then again, the chances of delivery can be faster. So if your cervix is fine, there are no complications, and if you're hale and hearty, then obviously exercises is something which we always say is a must in twin pregnancy and in normal pregnancy. वो रुकता नहीं है, वो चलता रहता है, वो चलना चाहिए. Your diet, your exercises, and your lifestyle thing should continue in any form of pregnancy that is going on.
So now the next question they want to know is that problems are expected with these babies after birth also. So how can one prepare for post-delivery period in case of twins?
Okay, problems are expected only when we don't know about it. Nowadays, with our advent of sonography and our knowledge about twins, the problems are very less. We do proper sonographies which tell us whether there are any structural complications like heart mein takleef that we were discussing, lungs या limbs में तकलीफ है, that the sonography will tell me about it, and we already plan for it. The late term complication that we're expecting can be basically because of preterm deliveries. That also we are prepared about it. Yes, like I said, complications will be there, can be there, and is usually seen. But can you hear me?
Yeah, I can. Yes. So, shall I ask the next question?
Can you
Can
hear
you
me?
hear me? Yeah, I can hear you. Can you hear me?
Okay, I'll just go on. So we are more well versed about tackling the complications currently at our age. So it shouldn't be a difficulty once we know that yes, this is what we are supposed to come across, and then it becomes easier for us to manage all.
Right. So now this lady needs to know that is bleeding expected to happen in twin pregnancy before delivery and after delivery also is more bleeding expected in twin pregnancy?
Uh, can you hear me?
Sir, you're audible. So, sir, we are waiting for ma'am. Actually, she left the session. So, just a moment.
Yeah,
Hello, can you hear me now?
I
Yes.
can hear you.
There was a blackout.
Yeah.
So sorry about this. Now the next question that about the bleeding you have told us. Next thing that they want to know is that there are certain problems that happen during pregnancy only, and like one baby will grow lesser than the other baby. So are those babies to be delivered early, or how do you manage them?
This is discordant twins. Usually, this is also one of the things that we can notice that one of the baby outgrows the other baby because there's a fight for nutrition. एक को ज्यादा चाहिए एक को कम चाहिए, so there's an in utero fighting जो शुरू हो जाती है. But then we have to remember that if the baby's weight, the difference between two babies' weight start increasing, and if it's more than 500 grams, or if the discordancy or weight percentage wise it's crossing more than 10%, then that is something that is to be worried about. And that babies, both the babies have to be removed at the same time. It's not like the bada baby can be removed earlier and then you wait and then again wait for the chota baby to become bada and you remove it. Both have to be removed this. But then what we do is a sonography study. So we check for different parameters, not just the birth weight of the baby, weight of the baby. We check for the bladder. We check for how much the bladder is filling. We check for the percentage of growth and individual growth also, not just in comparison, but individual growth also. When all these things are taken into consideration, we have a graph that we plot into. And when we find that, yes, there's a difficulty that can arise because one outgrows the other, we are worried about not just the smaller one, even the bada one. So then the difficulty is the delivery is imminent, and you have to deliver the babies at the same time.
Right. So is anemia more common due to nutritional reasons in these pregnancies?
A lot of things are more common. Again, complications are double. Twins है तो ऐसा नहीं है कि सब कुछ simple रहेगा. Everything is double. Happiness double होता है तो complications भी double रहेगा. So anemia is also a risk because body starts gaining more weight, more water is retained, so you have dilution anemia, which is more. That is there, which is physiological. Plus, your requirement also is increased. You have not one or two babies, so your requirement is more. So the body takes in more from your system and gives the baby. So your requirement of iron or hemoglobin also will be a little less. So your requirement of iron will be more. But then it depends on your blood parameters. If your stores are good, then we are not worried. But then we always keep a check yes, your hemoglobin should be in the normal range because complications की uterus बहुत ज़्यादा बड़ा हो गया delivery के time also you can bleed more. So I have to be worried about that part. तो इसके लिए हमेशा हम check करते रहते हैं कि overall throughout the pregnancy your hemoglobin should be normal and beyond that.
Right. So now that lady is asking, okay, what specific changes do you recommend in diet? Should we start eating for three if we are pregnant with twins?
वन ही कर लो वो भी बहुत बड़ी बात है, वो भी डिफिकल्ट हो जाएगा. But then understandably the space is less, your symptoms are more. फर्स्ट ट्राइमेस्टर में वॉमिटिंग, सेकंड ट्राइमेस्टर से कंप्लेंट शुरू हो जाते हैं, इंडिजेशन, थर्ड ट्राइमेस्टर में यू डोंट इवन हैव स्पेस इन योर abdomen to eat food and to let it digest. So you have to be very wise when you're thinking that yes, you have to eat because you have two pregnancies, your requirement might be a little more, but then it's not like you keep on stuffing for three people. You have to take it only for yourself, and from there it will be diversified to both the babies. So what you do is wisely plan out the meals, separate the portions, take smaller portions, hydrate yourself well. So my thing is always sorted because I have a nutritionist. They go to the nutritionist, she plans it out. So mera thoda headache kam ho jata hai. But then yes, this is one of the ways which I tackle it. But otherwise, you have to tackle it. You have to know that you can't be eating food for three people. Eat for one person only, but then split it out. Eat more healthy food. Avoid a lot of spicy and oily food, which is basic for any pregnancy that goes.
You have very beautifully explained everything. Just a take-home message, if you can have one for the
So,
twin pregnant women.
sure. So idea of whatever you're seeing in the Bollywood movies is not something which happens in real life. Twin pregnancies have its complication. Yes, we get a lot of women who come and ask that twin चाहिए करा दो. होता नहीं है, ये हो जाता है. But if you have it, then we tackle it wisely. Complications will be there, are there, like I said, but then we are very much capable of nowadays with our technology and which our ultrasound and with our medical advancement, we are very much well to do with anything that can happen during that entire pregnancy and even after that. So it's not something that we'll be worried about, but we'll be more careful for you and we'll be more concerned about you and help you deliver well and give you a better outcome. Thank you. You're on mute, man. Can't hear you. You're on mute.
Could we have the certificate, please? Can you hear me now?
Yeah, we can hear you. Thank you so much.
Hello, can you hear me now?
Yeah, we can hear you, man.
Okay, okay. Could we have the certificate, please, for Dr. Keith?
Thank you so much.
This is a small token from our side. There was a lot of internet problems today, and I'm sorry for that. But overall, I think I've really enjoyed talking to you, and so would have our audience. So that will all be for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Thank you.